In tonight's Be Healthy, a time that should be the happiest for new mothers can be very sad with the case of the baby blues. For some women, though, it can be postpartum depression, which can be dangerous. And now the state is expanding a program to help more women.
You have grass in your...
Megan Fazio's dream came true when her son Will was born.
You want to go on the swing?
After fertility issues, she and her husband finally had an adorable bundle of joy.
He was born April 18th of last year, and the first few weeks are just crazy for every mom, and you hear that all the time.
But unlike some moms who get a case of the baby blues with hormone levels changing after birth, Megan's didn't go away. Things got worse. She says she felt constant anxiety, like one constant panic attack. Her chest would tighten, and she had hot flashes.
I felt so bonded with him, but something didn't feel right, so then I felt guilty.
And then there was her lack of sleep.
He was a really bad sleeper, and it kind of went into, okay, he's not sleeping tonight. How am I going to get through tomorrow?
UConn Health Center clinical psychologist Steinberg-Gallucci says postpartum depression affects 10 to 15% of new mothers. The cause is a mystery, but she says sleep deprivation plays a role.
Many new parents have sleep deprivation, and it is a real concern because anyone with a mental disorder or not who is deprived of sleep can experience psychological difficulties, become disoriented, and even become psychotic.
For Megan, the anxiety was taking its toll.
So then it went from there to kind of a depression of, I feel awful, I'm constantly worried. Physically, I felt terrible, and my muscles were always clenched, so my legs hurt.
Megan found relief from professional help that included group therapy with other new moms. Steinberg-Gallucci urges women to seek professional help if they can't care for themselves or their baby properly or have thoughts of harming the baby. She says a new grant from the state's Children's Trust Fund will expand support networks and allow for more home visitation.
So these are women who are getting home visitation services and then are screened for depression, and then we are able to treat them in their homes.
As for Megan, she encourages new moms suffering to trust their instincts and not be afraid to ask for help if things get overwhelming.
She was wonderful sharing her story. That grant is for $450,000 over 3 years. If you'd like more information, head to our website, NBCConnecticut.com, and search link.